So aside from some of the drugs that have been talked about, that is atropine, pilocarpine, which have been alluded to, and some of the other newer ones like the levodopas, what are the other drugs that we use in strabismus surgery? One is Botox. Botox came into, you know, that Botox was first used by ophthalmologists for squint. It was only then that the cosmetic surgeons and the skin specialists snatched Botox away from us, but basically it's our property. It was used first in ophthalmology, and then only the others discovered its use for other things. So basically what does it do? When you inject a small quantity of Botox that is pulling the eye out of position, the drug causes a temporary weakness in the muscle. The beauty of Botox, its strength and its weakness is that it's temporary. Its weakness because if you want to do, if you want permanent correction, you have to give repeated injections, and that can prove expensive. And the good thing is that if you do harm and you inject too much Botox or you paralyze some wrong muscles, everything is reversible. So it usually causes a large overcorrection. During this time, the opposite muscle pulls the eye across and tightens while the paralyzed muscle is stretched. So this weakening, strengthening, tightening which happens after a course of 2-3 times, you may not require any more Botox even after the paralysis wears off. What are some of the uses of Botox today in ophthalmology? So to cure small degrees of strabismus, including over and under corrections, you have operated the patient. Now patient doesn't want any further surgery. You have overcorrected little or undercorrected. You give Botox maybe 3-4 times and then it becomes normal. During surgery, if there is a very large misalignment, which is more than, suppose there is 25 degrees of squint, and you know that in your hands, with using only one eye, you can only correct 20 degrees. For the remaining 5, you can give Botox, so small amounts so that you can get a perfect correction. Someone who has had multiple previous surgeries. I had a patient who had 4 surgeries done before and came to me with a squint. Now, I am not going to be the brave 5th surgeon to try and restore this. So it's much better to give a little Botox in the eye, which in the muscle which is overacting, and see whether we can get a good correction. And in some cases, when you're waiting, for example, a 6th nerve palsy, you're waiting for the patient's palsy to disappear. In most cases, the 6th nerve palsy recovers in 3 to 6 months. So in the meantime, you want to make the patient a little more comfortable by getting the eye orthophoric in primary gaze. You can give a little bit of Botox in the medial rectus muscle. So there are benefits, there are limitations. Sometimes you get permanent improvement after a few injections. It's quite simple, it's quite easy. You don't need an EMG machine, though the strabismus specialists will use it with an EMG machine. That's because you have to earn little more money than the general ophthalmologist. But otherwise you can give Botox even without that. If it doesn't work, surgery is still possible. It can be repeated. But as I said, sometimes after a few injections you get a permanent result. The new thing which has come in is the use of Botox with bupivacaine. Quite by accident they realized that when we give retrobulbar blocks and some of it percolates and permanently it goes into the muscle sheath instead of peribulbar, it can cause a temporary loss of function, and when it causes a loss of function, it is followed by overaction of that muscle. So they found funny things happening when they injected into the muscle by mistake. They found that initially the muscle fibers got killed. When they got killed, that muscle underacted. But then regeneration occurred, which was even more profuse than the previous. So if there were 10 fibers which died, 100 fibers were born. Just to give you a very obscene example. And then that muscle became overactive. So they said, if this happens by mistake, let's see what we can do to a 6th nerve palsy. So in a 6th nerve palsy, you inject Botox into the medial rectus. So you're trying to make the eye straight, and you prevent lengthening therefore of the paralyzed lateral rectus, and you inject this bupivacaine 0.75 to 3% into the lateral rectus. Now this lateral rectus, as I said, magically becomes stronger. So this is the new concept that came in. More trials are needed for this. Then we need to talk about drugs which are used in myasthenia. Now what is myasthenia gravis? It's an autoimmune condition with antibodies binding to the receptors in the muscle, preventing them from taking out. You need acetylcholine. Whenever you want a muscle to twitch, you need acetylcholine to go into that muscle and cause the twitch. Now, if for some reason there is no uptake of this, then the muscle doesn't work, and therefore the muscle, if it's a eyelid, it will droop. If it's a horizontal muscle, you'll get a palsy. So how do you prevent this? Drugs called mestinone or pyridostigmine, it's a cholinesterase inhibitor which blocks the breakdown of the acetylcholine. So acetylcholine is being broken down. Something which can prevent the breaking down will allow more acetylcholine at the neuromuscular junction, therefore will facilitate normal functioning. What are the other drugs? Immunosuppressive agents such as steroids are also effective. They block the immune response involved in myasthenia. So it's a different mechanism. Also there is plasmapheresis. Now in myasthenia what happens, there are antibodies which are produced to the acetylcholine, and that takes away your acetylcholine. So if you change the whole body's plasma, take it out, put fresh plasma, minus those antibodies, in effect you're getting rid of the myasthenia. So plasmapheresis has been tried. Then IV immunoglobulins have been tried as an intravenous therapy for this. And in some cases there is a thymoma or an excessively acting thymus gland. In those cases, surgical removal of the thymus gland will prevent the symptoms. Again, I thank you very much. And